I've spent the last few years working for one of the largest shockwave clinics in North America, and I've learned a thing or two about the power and untapped potential of regenerative medicine. But the march towards a future where sickness is healed from its root cause is challenged by the influence of big pharma and their deep pockets. So now we're forced to answer questions like, how do we get rid of joint pain, take back our performance in the bedroom, and heal diseases from the inside out without Bandaid medications or negative side effects? This show will give you the answers. Follow along as I interview the world's top experts and doctors and how they transform their lives and their patients' lives using the newest advances in biotechnology. I'm your host, Austin James Wolf, and you're listening to Modern Biotech Radio. Hey, what's up, guys? Welcome back to another episode of Modern Biotech Radio. Today, we have Dr. Amy Killen. How's it going?
Good. How are you?
Good. So people in my space know a lot about you, but for any listener that hasn't heard of you yet, can you sort of give like a little bio of, what you specialize in and what you do?
I say I specialize in skin and sex. Specifically, I do regenerative and integrative therapies in combination to help with skin, hair, and sexual optimization. My background is actually emergency medicine, so I was an ER doctor for about 10 years. And then about 8 years ago, ended up transitioning over to learning more about longevity medicine and anti-aging medicine and all of the stem cell medicine, and now have kind of tuned my niche into mostly skin and sexual function.
Mm-hmm. And what made you transfer out of being an ER doctor into what you do now?
So I had I had three kids in 2 years. I had twins. I had another baby 20 months later, and my husband was out of state. So I was basically working full time in the ER in this very stressful job with all of these children. Right. What I saw in myself was that I was just becoming very unhealthy. My diet, my stress levels were high. I was drinking a ton of soda. I wasn't exercising. Just all the things that people do when they're overloaded. Right. At the same time, I started seeing that my patients who were coming into the ER, most of them had chronic medical problems that we weren't solving. We were just kind of band-aiding and sending them out. And I realized that if I wanted to help those patients and also help myself, I needed to sort of learn some new things and some new tricks, and it sort of develop a whole new toolbox for treating and preventing illness. That's kind of what started it.
Right. So you just said Band-Aid solutions. That's something that's a term we use a lot around here. Can you just go into that just a little bit? Like, what do you mean by Band-Aid solutions? What does that actually mean?
It's just basically quick fixes that will help the symptoms of whatever's going on for a short period of time, enough to get them out of the emergency room, out of the doctor's office, out of pain momentarily. It's basically things that you can do that are quick fixes, but they're not actually fixes. They're just kind of making things look better from the outside. It's kind of making the optics look better, but not actually fixing the underlying problem. Right.
Okay. Got it. And so you wanted to, start your own practice and help people actually fix the root of the problem rather than just, slapping a Band-Aid on and saying, all right, good luck.
Exactly.
Awesome. So let me ask you this. What's in your toolbox for actually helping people with the root cause of their problems? What sort of tools do you use in your arsenal to help with this?
We use all kinds of things. We do a lot of hormones, so a lot of bioidentical hormones. We do, lifestyle, looking at lifestyle, exercise, nutrition, stress management, things like that. And then I have also the stem cell and regenerative medicine toolbox, which is going to include, stem cells and exosomes, PRP, as well as some of the, the things that I call the energy treatments, like the shockwave therapy, the light therapy, the lasers, all of that, which are also regenerative as well. Right. So it's basically a combination of all of these things and using those together to help really, improve symptoms and decrease problems in the future.
Right. And we use the word regenerative medicine a lot, but just in case someone is listening in for the first time and they just heard regenerative medicine, what is regenerative medicine and how is it different from other types of medicine?
So everyone has a different sort of definition of regenerative medicine. To me, regenerative medicine is using your own body to heal itself, and by whatever mechanism that is. So that's maybe PRP, which is platelet-rich plasma. You're tricking your body into thinking there was an injury, so it would heal itself. Stem cells, similar kind of mechanism, exosomes, things like that. But I even consider some of the things like shockwave therapy or laser therapy to be regenerative medicine, because they're really creating either an injury or a micro trauma and tricking your body into healing itself.
Right. Yeah. I would definitely consider shockwave therapy too. Can I ask you this? A lot of people ask me, what's the difference between acoustic wave therapy and shockwave therapy? Can I just get your words on that?
So my words on it are, yeah, it's very confusing because if you look at the literature, it's described as there's acoustic wave therapy, there's pressure wave therapy, there's shockwave therapy, and then there's trademark names of various sorts out there as well. But really, they're all similar modalities. It just depends on how you're using them. There are different types of shockwave therapy. For instance, there's radial versus focused, a focused beam. One of them is more of a less focused beam. So there's some intricacies like that, but it's all using high intensity sound waves to create micro trauma in whatever tissue to then increase blood flow and stem cell recruitment and things like that. So I use the terms interchangeably, but I usually just say shockwave therapy because I think at this point, if you look back at all the studies, that's kind of the most common way it's described in the literature.
Right. Okay. Now I wanted to sort of shift gears. This is a question I was dying to ask you since the moment you brought it up. But you said sex and skin. How do you help people with sex using regenerative medicine?
So I use a combination of things. I use PRP. I use stem cells from the patient. I use exosomes, injections, into the sexual organs for men and women. I also use shockwave therapy, both for men and women. And in women, I also use different lasers and radio frequency and things like that in combination, with the integrative therapies like hormone balancing, et cetera.
Okay. Let me ask you this. If there was a guy and he came to you and he said, all right, look, things aren't as good as they used to be, but he's like, I will do whatever you say, whatever treatment you recommend. If you just had someone that, paid you for everything you wanted to do, what would be the dream sort of process you would take someone through from beginning to end to sort of help them overcome that problem?
Oh, that's a good question. The process would be a process. It wouldn't be a single treatment. It would be something that we would work on, over maybe 3 months, 6 months, depending on kind of where they're starting from. So I would start with, lifestyle management, making sure that they're doing all the things, exercising, eating clean, meditation, stress management, et cetera. Get their testosterone where it needs to be, make sure all their other hormones are balanced. And then I would do probably a one procedure where I was able to do injections with preferably stem cells, exosomes, and PRP. Those are kind of, I like to use all of them when I can, but that usually requires some sedation and it's a little more expensive. So if not, then I would at least use exosomes and PRP, do injections into the penis. I would follow that immediately with shockwave therapy in the office. And then I would have them do a shockwave therapy regimen at, where they were coming in to do shockwave therapy or doing it at home, potentially with newer devices over the course of probably at least 6 weeks, maybe more, depending on the person. And I would be continuing to work with them also on just, again, the lifestyle stuff and making sure that that's all tuned up. And then we could add some peptides and other things on there as well if we needed to, but that's my sort of starter package.
Yeah, no, I love it. That's great. Okay. Now this is another question I like to ask a lot of people. How would you describe what exosomes are to a 4-year-old?
That's a great question.
Maybe a 6-year-old. Maybe a
6-year-old. Okay.
Yeah. Okay.
I'm not sure a 6-year-old would understand it, but basically what I tell people is that exosomes are like the action arm of. So you have a stem cell, which is pretty big, and it floats around. But when it wants to communicate with other cells, one thing it does is releases these little bitty bubbles. I call them these little messenger bubbles that have information from the parent stem cell, but those bubbles float around and then they get taken up by other cells, and those bubbles end up changing how those other cells behave. So it's essentially a communication mechanism between stem cells and other cells that are just little bitty tiny information bubbles.
Right. Okay. And let's say you got a stem cell in there and it's communicating with, other cells around it with these exosomes. How does it actually help someone improve their sexual performance? If they get an exosome injection, what does that actually do? So what most of the research has been done is actually in stem cells themselves. There's some research with exosomes. There's some animal models now with for erectile dysfunction with exosomes, but for the most part, it's looking at actual stem cells. But what they do is they increase the signals to the cells around them, telling them to do things like increase blood flow, increase blood vessel formation, increase other stem cells recruiting to the area, increase local nitric oxide, regenerate nerves. So it's essentially a repair signal that the stem cells or probably the exosomes are sending out saying, hey, let's repair this tissue that is maybe not what it used to be. And that's a whole bunch of different things, but that's kind of the combination that happens in the animal models and the human studies that we've seen. Right. Have you noticed any difference between using just PRP versus using PRP and stem cells and exosomes?
Yeah, I definitely think that adding either exosomes or stem cells or both is more powerful than just PRP. Now, people always ask me, my patients, well, tell me how much better? Because, it's more expensive to do that, obviously.
Right. Yeah.
And unfortunately, we don't know because no one has done studies that compares just PRP versus just exosomes versus PRP with exosomes versus stem cells. Like, it just hasn't been done. But in sort of anecdotal experience with my patients, I've definitely seen better results with either stem cells or exosomes in addition to PRP.
Yeah. I don't know if this can remain anonymous, but do you have any patient success stories with using exosomes?
I have a lot of patients who just basically will call me up later and say that things have gotten better, like that their erections are harder, that they're stronger, that there's less refractory, the refractory period is shorter, that things are more sensitive, things like that. I've been using exosomes for about 3 years. Most of my patients, probably 70% of them, I'm using stem cells also, because we're usually doing these kind of big procedures in my practice. So most of my experiences are with both. And I definitely have some amazing stories where I used both. But the patients that I just use exosomes, there aren't as many of those, but I certainly have, just general improved sexual health stories.
Right. The phone calls, hey, had sex with my wife for the first time in years,
Yeah.
Those are always good.
So, it's so funny. I have patients that I'm like, I'll be talking to them. I'll call them to follow up and I'm talking to them. I'm asking them questions. They're like going on and on about their sex lives and their, their orgasms and all these things. And I'll find out that they're like in the middle of the airport or something. And I'm like, you could have called me back.
Oh, wow.
Yeah. Yell at this at the airport, but people are excited, which is what's so fun about this field of medicine, is men and women, when they see improvements, they're super excited to talk about it.
That's really funny you say that. When I was first tasked with following up the patients, the first one that gave me like a 20-minute story was also about to hop on a plane. Yeah. That's really funny you say that, huh? Interesting.
Definitely. I've gotten some airplane.
A lot of airlines, yeah. That's awesome. Let me ask you this. In your personal opinion, why isn't every doctor doing this?
There's probably a lot of reasons for that. I think that it takes a long time for something to become standard of care in traditional medicine. So even though, shockwave therapy has been around for 10 years, and there are over 40 studies on it that are all positive, and there's no significant side effects or risks or problems. And still the urology, or your groups out there continue to say, we need more information. We need more information. And I think that I understand there's not like big double-blind placebo, trials out there on any of this stuff. Right. But there's enough small groups of information to know that these are at least safe, and how effective they are is going to depend on the person. But I think I think that people are scared to try new things, and it just takes a long time for the standard of care to change. Some of these things are also expensive. Some of these therapies are, and insurance is not paying for them yet. So that comes out of pocket. And so people become concerned when they have to pay for something out of pocket. They worry that it's, that someone's just trying to make money off of them.
Yeah. What made you decide to start doing shockwave therapy at your clinic?
I've been doing it again for about 3 years. I started that after just learning that there were people out there that were having really good successes with it. So I started, reading about it. I read all the studies. I started diving into that. My whole goal with patients is to give them as many tools as I can, because no one thing is going to help everyone. And for most things, whether that's for skin or for sex or for hair restoration or whatever it is, you're really going to want to put several tools together to get the best outcome. So that's my whole goal, is putting things together that are safe, that can be additive to each other.
Right. That makes sense. So you literally just saw success stories. You read the clinical data. I mean, it's the clinical data. I mean, you can't really lie with clinical data. I mean, I'm sure some groups can skew data, but I mean, you can't really lie with the data. So you saw it and you're like, okay, it's safe. It works. Okay, let's do it.
Yeah. There's so many studies out there on shockwave therapy. Like it's at this point, I feel like, you can not do it because you don't want to have to deal with it, or because it's, you don't have patients, it takes too much of your staff's time or whatever, but I don't feel like there's any other really good reason from a medical standpoint not to be offering this to men and women, actually, but mostly men is what's been studied.
Right. For sure. I wanted to ask this, what do you do for hair?
So I use the same kind of modalities, which is why I sort of do skin and sex. I use stem cells, exosomes, I use PRP. injections or microneedling for hair. And then I use like red light therapy as well, which is the low level light therapy, which is something else that I use, for women's sexual health also. So it's a lot of the same types of regenerative tools. And I have a lot of patients who will come in and get like just multiple procedures at one time, because we can get the stem cells once, get the exosomes once, inject them in all different parts of the body, and then, and then send them on their way. And it's a, 2-hour procedure, and then they're all set for a little while.
Right. Okay. I'm going to ask the same question. Let's say you have a guy and, he's starting to, thin out, and he comes to you and he says, all right, I will do anything you say. What would you have him do?
So I would first start looking at, for men, 96% of hair loss is, androgenic alopecia. It's almost always male pattern baldness. But I would still want to look at things like, are you taking testosterone? Because obviously that's going to increase potentially the hair loss rate because of DHT formation. What else are you doing? But essentially, and I would get them on something like a Propecia or finasteride, unless they just didn't want to take it, which some people don't. But that's great for decreasing DHT production. And then I would do some of the regenerative injections. Again, PRP and exosomes are great together, plus or minus stem cells, or even amniotic product can be good for hair as well. And then I would send them home with microneedling or a dermal stamper, which has like little needles that you can just stamp on your head, to use with either peptides. There's a couple different peptides I like for hair, or there's some other stem cell culture media products out there that I also have been experimenting with that I like for home. In addition to like the DHT blocking shampoos and some of the other over-the-counter products and supplements and things that they'd want to use at home, and red light therapy caps, the laser, laser cap, or any other brands out there that are going to give their increased mitochondrial ATP production for the hair follicle cells.
Right. Oh man, this is all exciting stuff. I love all this. Okay. So there's one, I've been studying, up on exosomes a lot, and but one part of my knowledge I need to study more on is peptides. Can you sort of explain to me what peptides are and what they can do for someone?
So peptides are just small proteins. It's just basically a short piece of a protein. And the way that they are used, it depends on the problem. You can use them for various things, for musculoskeletal pain, to try to improve healing, to increase hair growth, for improve sexual function. But it's basically just kind of the action arm of the protein that binds into the receptor. So these peptides are being put out by different companies to just do something very specific and act on a very specific receptor. Now, peptides are not regulated by the FDA the same way that drugs are, although some people argue that they should be, because they are kind of a drug. So it's difficult because there are more and more peptides coming out, and some of them don't have a ton of safety data behind them, so you kind of have to be careful. I don't use a ton of peptides, but I do use some topical ones for hair, and I've had experimented with some other ones for healing as well. But it's not my forte, but I have started to add them into my practice a little bit.
Yeah, awesome. That makes sense. What do you think the future of peptides, or what do you think the future of regenerative medicine looks like? Do you think one day all doctors are going to be using regenerative medicine? Is it something that's going to become mainstream, or is it something that, is always going to be niche? What do you think?
I think that as we're able to make more allogeneic products, so, there's two different types of stem cell products. There's the kind that, your stem cells being used on you, which is autologous, auto meaning yourself. And then there's allogeneic, which is someone else's stem cells being used.
Like an umbilical cord, or
Exactly, like umbilical cord products. So I think that because, obviously there are tons and tons of companies out there developing these allogeneic products for various things. I think as we get more of those products available, which are FDA regulated, and they go through all the trials and this and that, then I think that it'll be widespread, use of these regenerative products. I think that until then, it's a little bit of a niche market, because there's just a lot of ambiguity on the FDA standpoint. There's kind of some hate out there for people who are doing stem cells. The media has decided that stem cells are bad. So there's a lot of education, I think, that's required for it to become more widespread. But I hope it does. I think it could, and it could be really fabulous.
If there was one big domino that could be pushed down, that would launch, the regenerative medicine cycle and make it happen a lot faster, what would that one thing be?
Oh gosh. I think just making it a little bit easier to get some of these products to market, and the FDA has made it easier in the last few years to go to run through the rigmarole of trials on some of these products. But it's still not super easy, and still costs millions and millions of dollars to get these products out there. At this point, I would just like it for the FDA to say it's okay to use your own stem cell, my stem cells on me, which is the fact that that's sort of not allowed is a little bit crazy to me because it's my body. So some things like that are pretty low hurdles that I would think that we could overcome, but we haven't been able to yet.
Right. That makes sense. Okay. I'm going to shift gears and ask a little bit more about you, if that's okay.
Of course.
Okay. If you could do only one type of treatment the rest of your career, only one type of treatment, what would it be? Now, I know this kind of goes against integrative care. I just want to preface that. It goes completely against integrative care, which is very important. But if you could only do one, what would it be?
I think I would probably do the regenerative injections as my one treatment.
Right.
I really like doing a combination, so that's hard for me to say. But yes, I think I would do like the regenerative, stem cell injections for men, for women, for skin, whatever. But regenerative stem cells, exosomes, PRP at this point.
Right. Now, if you could only give yourself one treatment, what would it be?
The same. I love exosomes for myself. I have them in my office and I bust them out all the time and do various things with them. So, so yes, I would do that.
I'm kind of weird. I kept one of the vials. It's just in my car. Just like looking at it. It's cool. I'm like, oh wow, this is like the future of medicine right here. It's really awesome.
Yeah. It's really cool. It's really cool.
Yeah, for sure. Okay, who's one of your heroes?
I have a grandmother who's 99 years old, who's about to be 100 here in a few weeks. And whenever anyone asks me this question, I always think about her because she was the person, as we were growing up, like she had a treadmill back like before anyone even knew what a treadmill was. She did her own gardening. She grew her own food. She did stained glass. Like she's super artistic, did stained glass and played bridge. Like she's just a super healthy person who's lived for forever. And, I think that she's a really great role model to me and my family and other people who are trying to figure out how to be healthy and how to live a long time that way.
Right. Wow. That's really cool. Oh,
yeah,
I love
she's
that.
cute.
That's great. Yeah. Okay. If you were to write a book, what would it be about?
I've started writing books several times.
Really?
But
I've started a few.
Yeah, I always get sidetracked. But it's basically about some of these modern sort of emerging therapies for sexual health, using the things we can do to improve the physical aspect of health. I'm not an expert in the mental, emotional, spiritual, that side of it. That's not me. I'm not a sex therapist or anything like that. But the physical part, I really think is interesting, and I like talking about it, and I like the way people respond when they realize there actually are some options out there that are different than pharmaceuticals or things like that. So that's what my book will be about if I ever write it.
Ooh, I like that. So when are you writing it?
I know. I should be doing it right now. Now that I'm quarantined, I might as well just get to work.
Yeah, I know, right? What do you think the future of exosomes are going to be like? What's one thing that really excites you about the future of exosomes?
There's so much with exosomes that I think is going to be able to, that they're already doing, but I think will become more widespread. Even right now with the COVID-19 virus, there's some work being done with exosomes and using exosomes to potentially improve the ARDS, the respiratory failure, lung inflammation part of it. And they're starting to use those on patients with COVID-19. And I think that that's a great idea because we know that stem cells and exosomes they're immunomodulatory. They're going to help modulate how your immune system is acting. And, to me, this seems like a perfect chance to use some of these therapies that have been kind of scoffed at a little bit by traditional medicine. Like, let's get them in there and help save some people during this epidemic. But I think that we'll use them for all kinds of things, but I'd love to see them being used more like right now in hospitals.
Right, for sure. Absolutely. I know that there was one surgeon, he recommends his patients doing exosomes before and after he cuts them open. And he's seen no scarring after, after the patient heals up with exosomes. It's crazy. It's doing amazing
Yeah.
stuff.
So the work with scarring and wound healing, I think it's fabulous. I mean, I would recommend anyone who's going out and getting a surgery. I mean, obviously, hopefully no one is right now, but if you have to, then treating those wounds with exosomes as soon as you can afterwards, and doing some repeat treatments. That we've seen in wound healing literature that both stem cells and exosomes could be excellent for healing wounds.
Right. Yeah. Okay. Now we're going to jump into our behind the scenes Q&A. I'm going to ask some very, very, very interesting questions. It's going to get really fun. You can, guys, if you're listening to this right now, the behind the scenes Q&A is not public, but you can find it at modernbiotechradio.com, modernbiotechradio.com. Just go in, type your email, and I'll send you all these behind the scenes interviews, completely free. But we're about to jump into the behind the scenes Q&A. Before we do that, Dr. Amy Killen, where can other people learn more about you?
So just on my website, dramykillen.com is probably the easiest way. I have several websites, but that's the easiest one. And then I can direct you from there, kind of depending on what you're looking for and questions you have. I also am very active on Instagram at Dr. Amy B. Killen. So find me there. I like to post wacky, sometimes ridiculous things, but sometimes I try to do some educational stuff as well on there.
Awesome. Cool. Okay, so dramykillen.com. We're going to put this in the show notes. And then an Instagram that's at Dr. Amy B. Killen. Not .com,
yeah.
just at Dr. Amy. Cool,
yes,
sweet.
Exactly. Dr. Amy, yeah, that's
awesome.
Right.
All right, well, thanks for hopping on the show, Amy. I appreciate it.
Thank you. This has been fun.
Want to see what the top experts have to say behind the scenes? Just go to modernbiotechradio.com and you'll get instant access to every behind the scenes interview for free. Now, these interviews are not for the public, so please don't share. But if you'd like to pull back the curtain with me and learn what secrets they reveal, just go to modernbiotechradio.com and get instant access to these interviews for free. Again, that's modernbiotechradio.com. If you'd like to learn the best kept secrets that they can't share publicly but allowed me to share in private, just go to modernbiotechradio.com and get instant access to all of these interviews completely free. I'll see you there.